Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
When we think of the human body, we know that we are composed of vitamins and minerals and fatty acids, and of course we have all of those friendly bacteria, or ideally friendly bacteria, that help make up the human body. And it is through those vitamins and minerals and essential fatty acids that play these key signaling pathways when it comes to different enzymes being released and different hormones being released. And of course, when we think about different neurotransmitters. But there's one particular element in the body that oftentimes is very misunderstood. And we run across this when we're looking at different minerals sometimes. And sometimes people will hear about the dangers of chromium. So I want to highlight what chromium is, why there is that misinformation when it comes to chromium, and when you're taking chromium as a supplement, why this would be beneficial to optimize your overall health and wellness. So I'm Amanda Williams, MD, MPH, and let's get right to it. Let's talk about the confusion. So when we look at chromium, this is a trace element or mineral, and we understand that this comes in two different forms. So we have the trivalent form, and then there is the hexavalent form. It is that hexavalent form. Now, this is very important when we're thinking about structures, because this is what happens in the human body. Is if we take something in that is not in its proper structural form, the body oftentimes kind of goes haywire. And this is what we see in the hexavalent form of chromium. Now, this is the form that is used in like the automobile industry. This certainly can be toxic if you inhale that in. So we know that when we are taking chromium as a dietary supplementation, this is always in the trivalent form. Now, trivalent chromium, as opposed to the hexavalent, this is an essential micronutrient. So trivalent chromium, completely different than the hexavalent form. So when we look at what chromium is actually doing in the human body, most of the notoriety for chromium comes into play when we look at its role in glucose and fat metabolism. And we know that when we're supplementing with chromium, this can have an effect in terms of helping to support healthy blood glucose or blood sugar levels. So when people have elevated blood sugar and they take chromium, oftentimes we see this really nice balance that is produced from the chromium. So it helps to push that high glucose level down. And when we look at the science behind chromium, this is where it really gets quite interesting, because the more that we do when it comes to that regulation of blood glucose, oftentimes we get this dual effect because we're also helping to support fat metabolism. So this is why for many people, they used to look at chromium as a really wonderful supplement to use for working out and for losing weight. And it makes sense when we think about what this powerful little trace mineral is actually doing in the human body. So through that regulation of glucose and lipid metabolism, we understand now that that energy can help from the chromium to burn some of that fat and to help stabilize healthy blood glucose levels. And you can see now why so many people who fall into that category of insulin resistance or metabolic syndrome have maybe been told by a friend, family member, maybe their doctor, that chromium would be a nice addition to their daily routine. So I want to talk a little bit about the science behind this, because there was a really great meta-analysis that really added evidence to the fact that chromium supplementation could immensely support the blood glucose levels in diabetics. And this was published in the Pharmacological Research Journal. And through this meta-analysis, looking at these multiple different clinical research trials, they looked at 23 different controlled trials to evaluate the true effect of supplementing with chromium on your glycemic index. So looking at the blood glucose, hemoglobin A1C levels. And they found that in terms of the supplementation of chromium, it was when people were taking adequate amounts of chromium that they really started to potentiate these benefits. Now, the dose ranges in these studies ranged anywhere from 400 micrograms upwards to 1,000 micrograms per day, and this was out of those 23 different studies. And one of the things that they really were able to zero in on was the fact that the groups that were taking 600 micrograms and higher really were yielding those true benefits that go along with that chromium supplementation. Because remember, when it comes to dietary exposure to chromium, oftentimes we are not yielding enough. And we know that, potential chromium deficiencies can occur because of that lack of dietary exposure to chromium. So we can look at certain foods, mushrooms, for example, we know that those have a trace amount of chromium, but that's only really if they're grown in soil that contains a higher amount of chromium. So our intake of chromium oftentimes is limited to the foods that we're eating. And because of this, that potential for that chromium deficiency certainly does exist, and scientists are now much more aware of this. Now, interestingly enough, they found that when they partner up chromium along with magnesium, this is really kind of that 1-2 punch for helping to support healthy blood glucose response. And this is key because in the studies with that combination of magnesium and chromium, they found that when they took groups of people who were insulin resistant and they gave them that combo of chromium along with magnesium, they started to see this significant lowering of their fasting blood glucose, their fasting insulin levels, and markers for insulin resistance were certainly starting to improve. So all of these different things that we know, and we know that the way in which they're working is through these different pathways, through the expression of GLUT4, for example, and I'm not going to get too heavy into the details on that one, but just so we understand, scientifically speaking, we talk about how different minerals can help to enhance either the production of certain enzymes or activation of certain pathways. And we definitely see this to be the case when we're looking at chromium. So back to an article done through the Diabetes Education Journal, and this was probably over 15 years ago now, where they discuss the fact that chromium is this essential mineral that has this beneficial role in the regulation of insulin's actions in the body and the way that the carbohydrate and lipid metabolism is actually working. And so they go into the details that studies show that people who have type 2 diabetes and they also have lower blood chromium levels, they are certainly more prone to that insulin resistance. And like I said, low blood chromium levels is not an uncommon finding, being that many people can fall into that category of chromium deficiency. So seeing all these different things, seeing how when we incorporate chromium back into the system, we can start to really see a lot of those benefits. And it's not only through that improvement of blood glucose control, but we also see that when it comes to the maintaining of healthy weight. So a lot of information out there, a lot of science when we think about chromium and why the supplementation of chromium can be very beneficial for maintaining lean body mass and at the same time helping to regulate a better blood glucose response. So keep in mind when you're supplementing with chromium, we are using the trivalent form. It is that hexavalent form that we need to avoid at all costs, and that is the form that we usually find in, like I said, the automobile industry and the metal productions. But when we are supplementing, we're using trivalent, and this is where we can really get all of those benefits in terms of improved lipid profiles, so your cholesterol, and obviously when we're looking at your blood sugar levels. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram, and we will see you next time for another episode of the Invite Health podcast.